Great. So my name's Bex. I'm a clinical psychologist in the paediatric haematology team at St George's Hospital. So I'm going to talk a little bit about the psychological impacts of sickle cell. Just to explain a little bit about my role. So I am embedded within the paediatric haematology team and work alongside doctors, nurses, pharmacists, dietitians, anyone within the hospital, the school hospital as well. Just to kind of flag, I guess not all hospital teams will have an embedded psychologist. St George's is a tertiary centre and has links with other hospitals. So if you are if your child at school isn't supported with a psychologist in their hospital team, there will often be links to a tertiary centre where someone like myself will be able to provide that family and that young person with some support. The main areas of my role are helping children to understand their health, helping young people to manage their health conditions and things associated with it, thinking about education and learning. My role is a little bit different to CAM's, and children can access support from both teams at the same time. It's not a one each or one or. So please do bear that in mind when you're thinking about who's the best person to support a family. As we've already kind of heard, sickle cell can affect everywhere that blood flows. And I just think this is a really useful visual reminder of all of the complications that a young person can experience in the short term and in the long term. And I'm going to touch on a few of these today, such as neurocognitive dysfunction. We've also heard a little bit about treatments that young people are experiencing, and I guess just to flag that for a young person growing up, school can be a tricky time as it is, without having to juggle and manage a long-term health condition. And actually daily medication or monthly blood transfusions, which lots of our children are on, kind of distract and take time away from the things that young people really want to spend time doing, you know, with friends, family, school. And so it's an extra thing that a young person is managing. How I like to think about it is, imagine that a child's got an invisible rucksack on and they've already got kind of homework in there, managing relationships with friends, and then perhaps family difficulties that are going on. And then if you add in an extra thing in that rucksack of having to take medication or having to come for blood transfusions or experiencing pain, that rucksack is getting heavier and heavier and harder to manage. And so it's more challenging for that young person in their day-to-day life. One of the first things that I always think about is, what does a child or young person understand about their health? As we've already heard, you know, understanding what the blood cells do is really important. And I typically refer to donut blood cells, so those red blood cells that are round. And then we've got the sickle cells, which are more kind of banana shape. That's how I talk to very young children about it. And we really want to encourage young people to understand as much about their health condition from a really young age, because we know that knowledge is power, and we know that knowledge can bring understanding about medications and why medication is important and the role that it does. If you're just being asked to take a medication without really understanding what it does, the chances are you're not going to be very motivated to take it, and it's you're more likely to not take it. So actually supporting a child to really understand their health condition and to ask questions to the doctors and nurses and psychology team is really helpful. And if they're asking questions to yourself and you feel like you don't know the answer, please don't feel like you have to know the answer, but it can be more of a fact-finding mission together where you ask to contact their hospital team or parents and think a bit more about it together. What can be really helpful is children understanding in an age-appropriate way what can happen if perhaps they don't take their medication, so they might be more likely to become unwell. So that can be really helpful. We've already heard about the things that can increase the likelihood of a crisis. And sometimes I hear teachers or parents say to me, oh, it appeared to come on out of the blue. We weren't really sure why they experience pain, or it's been happening a lot recently and we're not really sure what the trigger is. You know, we've kept them warm, they've been really hydrated. And actually in that time, keeping a pain diary is something that is really, really useful and really helpful, because it helps, how I explain it is like becoming a bit of a detective and helping us to think about what actually might be underpinning this pain or the fatigue that a young person is experiencing. So things like where is the pain? What was the young person doing just before they experienced pain or at the time? And then recording some other things as well, like medication that was given, other things that they tried, and if the pain rating comes down. And the reason for keeping this pain diary is because I'm going to talk a little bit about the impact of stress and worry. And actually, sometimes this pain diary can help us to understand perhaps periods in a child's day where they're perhaps feeling more stressed and worried, but they don't feel able to articulate it or share it. And this can help us to see patterns perhaps over the weeks or months, if it's always a Monday morning or it's a particular lesson. So that can help us to really target intervention and support to make it as meaningful and useful as possible. Just a little bit about pain from a psychological perspective. So we know, I describe pain as there's many ingredients. When you're making cake, there's many ingredients that go into it. Pain is really, really similar. So of course, we've got the biological process of pain, which is the change in blood cells from those donut blood cells to those banana-shaped blood cells. But we also know that there's many, many other things that can, how I explain it is turn up the volume or turn up the intensity of the pain. And those are things like sleep, how a child's feeling if they're worried or anxious or low in mood, their past experiences of pain and perhaps memories of past hospital admissions or worries about what might happen in a hospital admission, how people respond to them when they are in pain, and perhaps their own thoughts and beliefs about what that pain might be a sign of, or if they might be worried about it. And how psychologists understand pain is in a biopsychosocial model. So that's thinking, of course, about the biological factors, but also about the psychological factors like attention, worry, our beliefs about pain, how we feel able to cope with it, and the social factors. If our friends know about it, if we feel able to tell people, if we feel like we will be believed, if we feel like people will be able to help us. And actually, there's a lot of research to show that the role of stress influences our nervous system, so the part of the body that controls bodily functions like blood flow. Mental stress can decrease blood flow, and what that does is increase the probability that red blood cells will become stuck and sickle, and then that leads to pain. So it's really, really tricky to separate out the biological from the psychological and the social factors. It's very much interwoven and a kind of web of different things. One of the things that we talk about really regularly with schools and with families is a cycle of worry and pain that young people can be really easily caught in. So, for example, I think someone mentioned earlier about exams. Naturally, lots of young people worry about exams. I think that's really typical, or worry about perhaps a certain subject and not doing well in that subject. That worry can lead to feeling kind of stressed and anxious, which is really common. For young people with sickle cell, that can increase the likelihood of them experiencing pain. In some cases, that can mean that young people might need to visit hospital for a possible admission or a review. And as we've heard, sometimes hospital admissions can be a review for a checkup and they can be sent home with some medical management, but other times, more likely, it is that they will be kept in from an admission, and then they will miss schoolwork, and then going back to school creates more worry about classroom learning and what they might have missed, what they will need to catch up on. They feel more stressed, and so this cycle can continue, and it's really, really common for young people to get stuck in this cycle at all ages. Often we think mainly around GCSE and A levels, but actually this is really common for young children as well, perhaps where they don't feel so able to articulate the worry that they're experiencing about classroom learning, or the challenges that they're having in classroom learning as well. And we know that teachers are really busy and perhaps might not always be able to pick up on some of the worries that young people have. Thinking about, again, that invisible rucksack, and juggling health and school, where young people do need time off. It's what some of the things that can be really helpful is schools planning how they can support a young person if they were to miss school, either through a hospital admission or through a planned admission, for example, for a blood transfusion. If they're going for a blood transfusion, typically that is a preventative treatment, preventing kind of experience of pain. And we would always encourage young people who are coming to St George's for blood transfusions to bring some work with them so that the hospital school can support them in completing that work. They're not typically unwell at that stage, so they're able to do work for that day admission. However, for longer admissions, our hospital school will support young people where possible. But actually, it's that going back and planning how a child can be supported to catch up on the work that they have missed. Often it's really hard for young people to prioritise work, and it's really hard for parents to know what needs to be prioritised as well. So supporting young people to choose the subjects to prioritise and helping them to go through that work in a one-to-one setting can be really helpful. Speaking to parents is always really supportive and helpful, and help creating a plan together. Some young people will require additional support, and actually one of the things that we recommend is a kind of touch point in the week with a trusted teacher, so that young people can develop a really good close relationship to enable them to share when they are in pain, when they're not feeling well, when they're feeling worried. Because often it's the sharing information, for example, like sharing if a young person is experiencing priapism, which is the key to then enabling medical support and intervention, but also psychological support to be able to put into place. Often schools have ELSA as well, which we would really advocate for young people being tapped into. That can be really helpful. So please don't feel like just because a young person is accessing psychology in the hospital that it precludes them from ELSA support. For some young people, they might benefit from further educational support due to cognitive impairments, and I'm going to talk a little bit about that later on. But one of the things that is included in our individualised healthcare plans, which are sent out to schools, is a pain plan. And this is a really useful tool that schools can complete with the young person in a collaborative way to think ahead of time, what can school do when a young person is in pain? And you can see we've got kind of, different levels of pain. And what can the young person do? So some of the things that we recommend is thinking about where on this pain thermometer or pain scale would it be helpful for schools to call parents to let them know that their child is in pain? Where does the young person feel like they're able to take paracetamol and ibuprofen and stay engaged in a lesson? Or where do they feel like actually they need to go to a rest room and have perhaps 20 minutes rest while that medication kicks in before they are able to reintegrate into the rest of the class? And one of the big things to think about is how will a child communicate when they are in pain? Who will that communication be to? And then what's the plan that will be in place? So this collaborative document really helps children and young people to feel like there is a plan in place for if they were to experience pain, and for them to feel more confident in letting people know. One of the things that I hear really often is that children feel nervous about telling teachers, and that's not necessarily because of anything that teachers have done. It's more because it can be really hard to put your hand up in front of a whole class and let teachers know. So thinking about non-verbal communication methods, like can young people put a pain card on their desk or a card with a symbol on to symbolize to teachers that they are in pain, and then a teacher come over and talk to them and check in with them. Again, this is really different for different age groups, so that's why it's really important that it's a collaborative kind of document. I'm really conscious of time, so I'm going to rush through. But attainment difficulties, the research tells us that cognitive difficulties are really common for children with sickle cell, and that is because where blood flows throughout the body, there can be damage. We know that blood flows through the brain. Sickle cell is the leading cause of stroke in children. And we know that cognitive difficulties, especially surrounding attention and concentration, are really common. And that is because of how the brain works and the network within the brain. It's a really vulnerable area for children with sickle cell. At the hospital, part of my role is to carry out something called a cognitive assessment that looks at a child's overall level of functioning, thinking about things like their processing speed, their working memory, their verbal comprehension, their visual spatial skills, and then their overall IQ, or their cognitive ability. This does not replace an educational psychology assessment. It is not generally a diagnostic assessment. It looks to see how the blood flow in the brain and how a child's health has affected their cognitive ability. And then I generally make recommendations to schools and families about how a young person might be supported, which are very individualised. If you have concerns about a child's academic attainment, we would really urge you to share these with families and contact their local hospital team to share those concerns as well, because it might be that a cognitive assessment is indicated. You can also tap into your local educational psychology resource as well. They are also able to do these types of assessments. However, they might not have, educational psychologists might not have as much understanding about the impacts of sickle cell, and we can't always expect them to. PICA is something that I'm just going to finish on. It's often something which is not very well thought of with sickle cell. When we hear about PICA, we generally associate it with autism or perhaps learning disabilities, and that can be more of a sensory feedback that a young person is seeking. What we know is that young people with sickle cell, about a third of young people will go on to develop PICA behaviours at some point. And that there's some tentative research which has linked it to a change in haemoglobin, and we know that sickle cell affects haemoglobin levels. PICA is a craving or an eating of non-nutritional substances. Often these can be things like toilet roll, tissue paper, cotton buds, baby wipes, kitchen paper, pieces of paper, and it is very, very common. It can cause abdominal pain. Because if you're eating something which your body can't digest, that's understandably very painful. Depending on what a young person has eaten, it can be very dangerous as well. Things to look out for at schools are chewing of sleeves on cardigans, jumpers, blazers. If a young person wears a hoodie, those drawstrings, very common as well. We often think biting at the end of pencils is very normal, and of course it is, but that's just something to be mindful, especially if a young person has sickle cell. Spending longer in the toilet just because of toilet paper, paper towels that young people dry their hands on, or if you notice that a child is handing in work with perhaps corners of the page ripped off, that is also a telltale sign. If you are concerned about a young person having PICA, please do monitor what items you think a child may be eating, and let the parents know, or the medical team. Please do not tell a child off, because often PICA comes with a lot of shame. Young people often know that they shouldn't be eating paper or these items. And if you've got a secret that you're trying to keep and then someone outs you on it and tells you off, it can be really shame-inducing. And what it can do is encourage young people to hide it more. So actually, we want to try and come alongside a child and supporting them in refraining from eating these types of substances. And that's where psychological support is really important. And if you are working with a young person who has pica, schools are often invited to attend part of that psychology session just to understand more about it. This is a very whistle-stop tour, and also understand more about how they can support young people, because it is a real systems approach to supporting that child with a very innate craving, which they don't often have control over. That is the end.